Dr. Nadeem Murtaza, medical specialist and nephrologist from the platform of my YouTube channel, Margalla calling. Today's topic of discussion is homeopathic treatment. Many times patients ask me whether they should seek homeopathic medicine for some of their chronic illnesses like kidney stones, headache, migraine, depressive illness, atopic eczema, rhinitis, and many more. I've got no clear-cut answer. So during the Eid holidays, I searched about homeopathic medicine, regulations in Pakistan and different countries in the world. And I am about to discuss all those things. It's up to the individual doctor, they write what they say. But what I am saying is evidence-based. According to World Health Organization, homeopathy is the second largest system of medicine. They have got, usually in Pakistan or in the world, it's commonly practiced, especially in India, and it has got a very large market, a large commercial market. In Pakistan, there is a National Council for Homeopathy, and they regulate affairs of homeopathy. They make the curriculum, and they hold elections, and they register homeopathic practitioners. According to the National Council for Homeopathy, they recognize only two professional courses of studies. One is BHMS, which is a 5-year degree program. BHMS stands for Bachelor of Homeopathic System of Medicine. And second is DHMS, which is 4 years, and that is Diploma in Homeopathic System of Medicine. It's diploma. The first is Bachelor, which is a 5-year program. On the same website, they have provided information regarding certain regulations in Urdu. Number one, they will write their name as homeopathic doctor. They cannot write doctor so and so with in bracket very small homeo, or sometimes homeopathic is missing. No, they have mentioned that both words should be of equal font size, and you can say caliber. Few things more. They cannot sign or attest birth certificate or death certificate. Similarly, they cannot provide medical fitness certificate, nor they can give medical rest, and they cannot practice surgery. You can see on the page as shown. One thing is more, these regulations may be changed from time to time. Let's see what happens in India or neighbor. Indian government recognizes homeopathy, one of its national system of medicine, and patients they can claim for its reimbursement. India has the largest pool of homeopathic doctors globally. Almost 2 lakh homeopathic doctors are practicing nowadays in India, and every year around 12,000 homeopathic doctors are added annually. A recognized qualification is required to practice homeopathy in India. Similarly, as in Pakistan, they have got a National Commission for Homeopathy, and it regulates two qualifications. One is Bachelor of Homeopathic Medicine and Surgery. It is a graduate degree award after 5.5 years of training, including 1 year of internship. Whereas the MD Homeopathy is a postgraduate degree of 3 years duration. Let's see what's written in Wikipedia. You can see on the page that homeopathy is a pseudo-scientific system of alternative medicine. This is the opening sentence on Wikipedia on the topic of homeopathy. In England, the NHS, what it says? It says that homeopathic remedies perform no better than placebos, that is dummy treatment. In 2017, NHS England said it would no longer fund homeopathy on the NHS, as lack of any evidence for its effectiveness. It's England. One thing more, on the NHS website on the topic of homeopathy, they have written that there is no legal regulation of homeopathic practitioners in the England. That means anyone can practice as homeopath even if they have no qualification or experience. That's about England. Let's talk about Australia. In 2015, the National Health and Medical Research Council of Australia found that there are no health conditions for which there is reliable evidence that homeopathy is effective. And this was published in Guardian as well. The Guardian, almost 11 years back, that's in 2014. Medical experts tested research treatments for 68 conditions and found they had no impact. We have discussed Pakistan, India, England, Australia, and now USA. FDA does not approve any homeopathic medicine, and in 2019 the FDA permitted unapproved homeopathics to be sold. Actually, there are state to state differences in the laws. Every state has got its own law, but in United States, practicing homeopathy or its sale is not prohibited. But FDA does not approve any homeopathic medicine. These are the medicines used in old times in United States, even when FDA was not an organization, Federal Drug Authority was not established. At that time, homeopathy was also practiced in USA. In France, in 2021, France phased out social security reimbursement for homeopathic drugs. But there is a factory called as company name is Boiron, which is located in France, and it is the world's largest manufacturer of homeopathic drugs. They wanted to sell its one or two factories in France, but they couldn't find a buyer. In Germany, one must attend a 3-year training program to be a homeopathic doctor. Homeopathic treatment are covered by 70% of the government medical plans, and homeopathic medicines are available almost every pharmacy in Germany. In January 2024, German health minister announced plans to withdraw all statutory health insurance coverage for homeopathic treatments, citing a lack of scientific evidence for their efficacy. Let's see when it gets implemented. In Spain, in 2016, the University of Barcelona and the University of Valencia cancelled their master's degree in homeopathic medicine due to lack of scientific basis after advice from the Spanish Ministry of Health. So they have abolished this master's degree in their country. In Russia, Russian Academy of Science says homeopathy is dangerous, pseudoscience that doesn't work. This was published in Independent, this is what you see is an English translation of Independent, which was published in Russia on 7th February 2017. In Africa, I'm not talking only about South Africa, it's whole of Africa. Actually, there are no official training facilities for homeopathic doctors. Moreover, most of the African countries, they are poor, and their traditional medicines, they are more practiced because they are cheaper, and the faith healers, they are commonly available in those poor African countries. And the drug market in Germany, France, United States, Australia, India, still in 2025, homeopathic medicines, they are being sold and widely used. Just imagine, in United States, the homeopathic market is worth about $3 billion a year. It's a big amount. Moreover, in Pakistan, homeopathic doctors, they can use, that's approved under the law, that they can use thermometer, blood pressure, hammer, tongue depressor, scissors, kidney tray, ENT box, X-ray vision box, torch, weight machine, stethoscope, glucometer for their diagnosis and remedies. Indoor treatment of patients in the light of Section 33 Act of 1965, they can admit patients, homeopathic practitioners can admit. So what's the recommendation? My recommendation is that allopathic doctors, I think they shouldn't comment on homeopathic medicine. Yes, they can quote, but they cannot say, yes, it's of no use. Number two, it's up to the individual. If they say that they get benefit, okay, let them, because they can get medicine from the market. Moreover, relatively, homeopathic medicine is cheaper and widely available. Not widely available, but the practitioners, they have medicine. Usually they have the medicine, homeopathic medicine. So it's my opinion. If you got any comment, kindly quote. I may be wrong, but what I have said is evidence-based, and usually nowadays only evidence-based medicine is being practiced. Many doctors, they say it's of no use in emergencies. Yes, it's of no use. If the person is coming to a emergency department in a teaching hospital or in any hospital or even in nursing home, he should get the benefit of allopathic medicine. And if he wants to get treatment for migraine from an homeopathic doctor, that is his right. Anyhow, thank you. God bless you all.